Now, we are going to talk about something that has fascinated me since I was a kid, and that's hypnosis. And I want to introduce you to Dr. David Newman. Welcome to our show.
Thank
David.
you.
And actually, you are with Missouri Hypnotherapy and Research Clinic.
That's true.
Right, in Jefferson City. Explain what that is.
At the Hypnotherapy and Research Clinic, we are full-service hypnotherapists, which means that we go through all the various issues people have. They may want to stop smoking, lose weight, test performance, sports performance. Any issue that you have, we can go ahead and we can make positive changes immediately.
How does hypnosis work? You're not going to do anything under hypnosis that you wouldn't do in your regular life, right?
You will not do anything under hypnosis that violates either your moral codes or something that you're just absolutely opposed to. What you will do is it will lower down your inhibitions in case of stage hypnosis, which we're going to give a demonstration of a little bit. But basically what I do is I go into your subconscious, I start talking to your subconscious, and your subconscious controls everything about your body. For example, your breathing, your heartbeat, that's all done by your subconscious. We don't think about it.
Can you, in hypnosis, tell your subconscious that you want to stop breathing?
No, you can't do that. You could, and the Shaolin monks, for example, can actually, under self-hypnosis, reduce their heartbeats down and their respiration down to where they will pass for dead, even on our modern instruments.
Is that right?
Yeah, and then they bring themselves back. So you can do it up to a certain point.
Okay. I mentioned at the beginning of the show that in China, surgery is being done at certain times without anesthesia,
Yeah.
but putting people under hypnosis.
Right.
They're having hysterectomies, they're having
Absolutely.
appendectomies, and they are feeling no pain.
None whatsoever. And also the interesting thing is your chance of complications are greatly reduced, and at the same time your recovery is greatly increased. So
how you're telling when they're being hypnotized, they are being told that they feel no pain, and they believe that they're feeling no pain, and their stomach is open?
That's true. That's true. As a matter of fact, I have gone into the surgical wards, when they're doing it, and the surgeon, for example, would say, I want to go ahead and irrigate this area, we're doing that. And I said, before you do that, just let me tell them to turn off the bleeding. And they look and they actually see the blood slow down and then retract back. So they still have to do some irrigation. So you're telling the person while they're under hypnosis,
right, control the bleeding.
That's right, and they will. The body will. The body will do that automatically.
Can anybody be hypnotized?
Anyone can be hypnotized.
But some people are more difficult to be hypnotized than others.
No, it's not that some people are more difficult. It's some people take a little bit longer. For those people that are very analytical, they are very much control-minded, they're afraid to release control, then in that case we have to use other inductions, but everyone can be hypnotized. Okay,
but before the show this morning, he was telling me, I said, well, go ahead and hypnotise me right here. And he said, right here. I looked at the clock. It was like we had 15 minutes before the show.
It was short, yeah.
And I said, hypnotize me.
Right.
And then you were doing it, and you said, well, no, you're too analytical right now.
That's right.
But you could hypnotize me.
Absolutely.
And how long would it take?
That I don't know. I would actually have to do some suggestibility tests on you to see how receptive you are, and also to probe in to see how I can tap directly into your subconscious. Once I tap into your subconscious, it goes very, very quickly.
Okay. But you're not good. I wouldn't do anything that I wouldn't normally do.
No, you would not.
Now, we're going to do a little experiment here today, and we have our floor director, lovely Janelle DeArmond. Here, get in here. All right. Janelle. And then we have
Kim Stafford, who's one of my associates.
Okay. Now let me get chairs for you. Okay. What are you going to do today?
Well, actually, I'm going to take a page out of your book. You were talking about China and doing hypno anesthesia.
Okay.
So I'm going to go ahead and do some hypno anesthesia.
Now you did a check on Janelle earlier, and
yes.
she can be hypnotized
very, very quickly.
Very quickly.
Yeah.
Okay.
Okay. So if it's all right, I'm just going to move up this way.
All right.
And ladies, what I want you to do is just
wait. I got some hypnotic music. Okay.
What I want you to do is just put your hand right like that for me. Okay. Just slightly above eye level. Okay, I want you to focus right here on your middle finger, middle finger, middle finger, middle finger. You're going to notice that your fingers are starting to turn into magnets. They're repelling each other. They're spreading. They're getting wider and wider, wider and wider, wider and wider, wider and wider, wider and wider. Your fingers are repelling. They're repelling. They're repelling. They're repelling. They're spreading, spreading, spreading. Jerking, pulling, spreading, 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 spreading. Wider and wider. Now you notice that your hand is starting to be attracted to your face. It's like your face is a piece of metal. Your hand is a magnet. It's moving in closer and closer, closer and closer, closer and closer, closer and closer, closer and closer. And when your fingers actually touch your face, you're going to go into deep sleep. Deep sleep, deep sleep, deep sleep. Relax. Relax, just deep sleep. Okay. Your fingers are ready. Your hand is moving closer, closer, closer and closer, closer and closer, faster and faster, closer and closer, faster and faster. As soon as your fingers touch your face, you're going to go into the deep hypnotic sleep. Deep hypnotic sleep. Deep hypnotic. Okay.
Okay, you're saying both of them are hypnotized.
They're
right?
they're hypnotized right now. So let me just show you just for a second. Janelle, I'm going to start pulling on your wrist right here. As I pull on your wrist, all the tension of the day is going to come into this wrist. It's going to turn just like an iron bar. An iron bar. It cannot bend. It cannot bend. The harder you try to bend it, you cannot bend it. It's absolutely impossible. It's absolutely impossible, and it's stuck in this position. Okay.
Now, how long is it going to be stuck in that position?
Until I tell her to release it.
It could be stuck in that position for hours.
Watch your hand. It's not going to move. Okay. Now, Kim, I want you to relax. Kim, this hand is becoming numb and insensible, numb and insensible, numb and insensible, numb and insensible. And when I drop your hand onto your thigh, your whole hand is going to be totally numb and insensible, numb and insensible, numb and insensible. Okay. Now, in med school, you learn how to do pain tests so that you can tell if a person's under. This is one of them. It's a cuticle test. I'll move right over. Just watch your face. Watch your eyes. You notice that there's absolutely nothing going on.
Oh.
I can go ahead and twist it.
Oh!
All I want.
Oh.
All I want.
So you could take a pin and stick her with that.
Absolutely. Your arm is stuck. It's stuck in this position. It's going to be tight like an iron band. It cannot move. Cannot move. Okay. Relax this arm. Okay. Now, Janelle told me she had 2 children. This will show you how you can go through pain-free childbirth. We're going to do the exact same thing. Janelle, this hand right here is becoming cold. Cold, just like ice. You can touch it. You can feel it's actually dropping in temperature. It's turning cold. It's turning cold. It's turning cold, just like ice. It's numb and insensible, numb and insensible, numb and insensible. You cannot feel anything in this hand whatsoever. Cannot feel anything in this hand whatsoever. It's totally numb
don't
and
do that to her.
insensible.
Don't open it.
She's not feeling anything.
She can't feel this?
She can't feel
okay,
anything.
wait, get a tight shot here. Get tight. Oh, I can't do that to her. She's such a sweetie.
Yep.
She can't feel anything. So this is how you would do. You would put someone
in. Feelings coming back in your hand.
Okay.
Yeah, absolutely. And
this is how you would do hypnosis and then do surgery.
Absolutely.
Are you going to take them out now?
Yes, I will. Okay.
Okay.
And when I count from 0 to 5, 0 represents the deep hypnotic sleep that you're in right now. 5, your eyes are open, you're wide awake. When I say 5, your eyes will open, you'll be wide awake. You're going to have a strange feeling of well-being. You're going to feel very motivated, very awake.
We got 30 seconds left.
Very, very awake. Ready? 0, 1, 2, 3, 4, 5. Eyes open, wide awake.
Now, do they know what happened?
Yeah.
So you know what happened?
When you're in hypnosis, you're super aware of everything. Everything that's going on unless I tell them not to remember something.
If you want more information on the... Boy, are we out of time. If you want more information on this, you can call Dr. David Newman, Missouri Hypnotherapy and Research Clinic in Jefferson City, 573-694-7785, or toll-free, 888-604-9997. And then there is a fundraiser coming up this weekend, right?
That's right. It's this Saturday night at the American Legion, post number 5. They've asked me to do some stage hypnosis. I'm going to do that, and it's an open mic comedy night.
Okay,
so
573?
Come in? Come on.
636-744.